TMG Pulse, Joe Mullings, unwinding the headlines, bringing you the recent post-COVID headlines. And I mention that because it's going to impact everything we do. 4 sectors where we'll see the first post-pandemic stars emerge. Payments go even more contactless. Startups with plug-and-play software will win in drones and robotics. Even complex business transactions move to the cloud. But here's the one that matters. Remote monitoring with devices we already have. So we've got a stressed healthcare system, so there's going to be changes in patient and clinician behaviors. Easy to use, accessible devices. If I had my iPhone out, I'd take it right now, but they don't allow me to have it on the set. But that's an important component. Go to interfaces for healthcare interactions and software solutions overlaid on existing devices. Why is that going to be important? Because the money spent is going to be down inside the hospitals, inside the healthcare centers. So look for these to affect what products get developed over the next 3 to 5 years. Headline: Butterfly Telic Guidance for remote ultrasound exam during COVID pandemic. Portable ultrasound wands turn a smartphone into a complete ultrasound system. Telic Guidance allows the physicians to still do the scan. They can be remote, and via your iPhone, they'll be able to connect with you, and they'll be able to read the scan and direct you via a teletherapeutic approach. So the cell phone links the patient to the clinician's computer. The number one out of the gate is going to be lung exams. That will be the primary focus of the technology. Pulmonary disease, second largest killer. Headline: Philips receives FDA clearance for a patch that monitors breathing. Even before COVID, Philips was working on this. It's a patch that sits on the patient and it monitors oxygen and respiratory rate. Those are 2 key indicators to let you know if a patient is deteriorating. Right now, it's being used in a hospital outside critical care, and it's going to connect the patient with its health record and also alert a physician on their personal device if there needs to be an escalation in patient care. Sensors and back-end software again, simplifying what's already being used in common everyday healthcare. Look, with the fact that capital equipment is going to take a major hit in medtech over the 2 years, you're going to see a slowdown in that capital equipment. These $500, $1 million, $1.5 million large robotic systems, they're going to be a pause. A number of reasons. First is hospitals have to come back to profitability. They took a beating. Again, 174% reduction in EBITDA margins. That's a lot of money that needs to be made up. So how are they going to do that? They're going to do that by continuing to increase technology, but it's not going to be boiling the ocean with robots. Second item there, change of centers of care for patients. No longer are we going to count on a hospital being a major lift of where you're going to go if you're a patient to have an elective surgery. This pandemic has had us evaluate the entire healthcare initiative. Remote technologies that are not going to necessarily be a pure play on a diagnostic, but what they're simply going to do is raise a flag to a clinician at a distance, so now I can triage that patient without having to get them into a hospital or a center of care. So simply raising a flag lets the clinician know I should see this patient and look a little closer. Really simple as that. This is what's going on right now, people. 40% of consumers still feel uneasy about getting back into a hospital. Care models, cost structure, and competitive dynamics over the next 3 years are going to change. This is going to impact career opportunities for you. All areas of hospitals and healthcare settings are under evaluation. COVID testing and screening is going to be commonplace over the next 12 to 24 months. Elective procedures are going to take longer, therefore less volume. And crisis level surgical procedures and PPE will be normal for sales reps and clinicians to have to be engaged with as they move into the care. You're going to see healthcare systems be quite different. You're going to see protocols change state to state. This is all going to impact your career on what you produce as a product, what you develop as a product, what you manufacture as a product, and ultimately what you sell as a product. This is Joe Mullings, Unwinding the Headlines.